What's mental health?
He asks all the questions everybody wants to know.
It basically includes our emotional, psychological, and social well-being.
You're driving me half out of my mind, you crazy old coat.
It affects how we think, feel, and act.
Oh my God.
Not just that, mental health helps to determine how we handle stress, and other things as humans. The Mind Clinic, a platform where people can talk about issues directly or indirectly on mental health.
We're up and grateful. It's a Wednesday morning in the capital. I'm Victor Purple. It's 8 o'clock and time for the Mind Clinic, proudly brought to you by Neem Foundation. As usual on the program, we've got the very beautiful Chinyerugo Densi. Good morning.
Morning, Victor. How are you doing?
I'm fine. I'm very excited to be alive.
I like your energy.
Thank you very much. All right, on the program this morning, we have a consultant psychiatrist, a managerial psychologist, professional speaker, and medical director of Tranquillian Quest Behavioral Health Center in Lagos. She has received trainings from King's College in London, the University of Washington, and the prestigious Harvard University, Boston, United States. She's a medical health advocate who's driven by the holistic view to health, and as such is a regular voice on various print and electronic media. She currently volunteers with the Lagos State COVID-19 psychosocial response team as a means of contributing her own quota to the fight against the pandemic. On the show this morning, we have Dr. Bonjubola Abiri. Good morning. Good morning, Doc.
Hello, good morning.
Thank you very much for joining.
Today.
Thank you.
Thank you for having me.
All right, then. On the show this morning, we're looking at treatment options for mental health disorder. Like I mentioned earlier, I want you to ask questions when the time is right. Please, as the conversation progresses, leave us a message on WhatsApp. We'll let you go ahead to ask your questions in a very civil manner. Chinyerugo.
Yeah. So, Victor, you know how we always talk about mental health challenges and mental disorders, and we try to tell people about the symptoms, what to look out for, but then we never always talk about, treatment options, and everyone just thinks in their head what they think, and they don't necessarily know. So today we're going to be looking at the different options available. I'm talking to a consultant psychiatrist, Dr. Abiri, with us. We just want to know about the different options, just to educate everybody. So we're going to start from the basics. What does treatment look like for a person with a mental health disorder? Dr. Bonjubola, what does it look like?
Well, thank you for the question. I think to be able to answer that question effectively, it would be nice to look at what the causes of a mental health disorder are. So we know exactly what it is that we're trying to treat. And when we look at causes, we like to look at it from the thought of, is it biological, psychological, or social? So these are some of the things that can, make a person have a mental health disorder. So it is a biological cause. Biological has to do with a disease state, maybe an imbalance of neurotransmitters, and the disease state can either be a physical or a mental health disorder. If it's a neurotransmitter problem, it means that there is either too much or too little of a neurotransmitter, which is a chemical hormone in the body. It is psychological. Psychological has to do with, issues with probably significant life events. So trauma, abuse, that the individual may have gone through at some point in their life. And if it's social, you're looking at social inequality, social adversity, economic issues, financial difficulty. So to then talk about effective treatment for mental health issues, it would be, are we treating biological? Are we treating psychological? Are we treating social? But very often, because we don't look at illnesses in isolation, we also don't look at our treatment options in isolation. And as such, it's the reason why whenever, even when you go to see a therapist or you go to see a professional, they're looking not only at the biological condition that you have at hand, but they're also looking at the psychological and social interactions of that illness. And it's for that reason that most times when we're managing a mental health disorder, we're talking about seeing a psychiatrist, a psychologist, an occupational therapist, or a social worker as well, because you want to look at that holistic approach to getting here and for that individual.
Wow, that was an amazing one. Most of the times we don't actually, most people don't realize that there's a lot behind it and there are different causes. And when you know the cause of a problem, you know how to treat the problem. And I'm glad you actually spot on mentioned that. There's a lot of myths around treatments, medication use, psychotherapy, everyone is always saying, oh, use medication, don't use medication. I think let's try and bust some of this myth around treatment when it comes to mental health disorders. Therapy versus medication. Let's start with that. Which is better? So, let's just look at that a bit.
All right, so therapy versus medication, and I will tell you again, we're going back to the holistic approach.
Mm-hmm.
So, first of all, I think it's important to, identify what therapy is. And therapy, pretty much, Englishman would say, therapy is a treatment intended to relieve or heal a disorder. So very often when we hear therapy, we're thinking about, a client comes in, lies on your couch, and you're, trying to do a sort of psychotherapy.
Yeah.
However, therapy is also, it puts into context the use of medication. And it's the reason why I said, we usually don't treat in isolation. We're looking at quite a number of things together. If I were to say or choose between therapy and medication, I would say the truth is you can't take one over the other.
Yeah.
Quite a number of therapists that you would go to meet would actually say to you that they would keep treatment with medication, oral medication, as a last resort, unless entirely necessary at that individual time, at that time of seeing the client. If there are other, cognitive or behavioral interventions that can be done at the time that, the individual goes to see the professional. So that can include talk therapy with, of course, a professional. So it's not just talking with just anybody, but talking with a professional. If the therapist or the professional then sees that the behavioral intervention we're trying to offer to this individual is unlikely to be able to be effective, they then recommend medications. Of course, medications is also recommended based on the severity, intensity, and frequency of the condition. So, for instance, if you have someone who is suicidal, you're not going to say go and talk to a therapist.
Yeah.
You're going to offer them admission, offer them medication. So at the end of the day, we need to individualize the cases that we see and not just, use a blanket treatment of some sort. We want to manage everyone at the same time.
Yeah, thank you for that. And one of the things I hear quite often, and one of the things most people will talk about when it comes to the use of medication is concerns about the side effects of medication. A lot of people have this conception that it will make you worse or it will make you quote unquote go mad. And I thought perhaps please shed some more light on it when it comes to medication and the use of medication and treatment.
All right. Well, so like I said, unless entirely necessary, medication will not be recommended. Just remember that the professional that you're seeing cannot, offer you any other, type of treatment aside asking you to be on medication. So what I often say is that there is no medication without side effects. So even as little as paracetamol, if not taken as it is intended, can have a side effect. There are even some people who can't take paracetamol as a medication because it affects them. Vitamin C, as little as it is, can cause adverse reactions. But another thing I often say to my clients is, if you look at someone who had cancer or someone who had HIV, what do you think their biggest request would be? To have something that would actually be able to manage them so that they can live for, a long time. Yeah. Research has shown that the use of medication is effective. Mm-hmm. Very effective, depending on depending on presentation. So that's another thing people don't like to think about. People complain about the fact that, the side effects are a lot, the drugs don't seem to be working, but the big question we should ask ourselves is, when an individual develops a mental health challenge, how soon do they present to the hospital? The medications used in the treatment of mental health disorders, no doubt, have side effects. Mm-hmm. So it's for that reason that we, advocate and encourage people to work in hand with a specialist who puts into consideration your mental health, but is also able to look at the clinical effectiveness of the medication and, put it against your clinical symptoms. As the individual starts to improve, as the symptoms start to get better, then of course, the doctor starts to reduce the dose and the strength of the medication that is given to the individual. So medications will have side effects. However, research is ongoing to find, better medications with lesser side effects so that individuals who use it can be compliant with medications. And of course, even if there are side effects, they are reduced to very tolerable side effects.
Yeah. So the big take home is medications will be given when necessary, and they do all have side effects like every other medication that we take. But it's very important for the individual to seek and to go to make sure that they receive the help from a professional who's going to work with them and understand, how best to work with them. So I think that's what everybody needs to understand, that just like every other medication, there are side effects to it.
Yes.
Thank you for clearing that out for us. So let's look at the different mental health treatment options available for the everyday Nigerian. We talk about the different things that we can do. What are the treatment options that are available for us? Where can we go to receive care? And what type of care can we receive as everyday Nigerians?
Okay, well, so it will be important in that wise, in answering your question, to talk about the processes available, the places available, and then the people available.
Great.
So the processes available, there are options for biological, psychological, and social intervention. For the biological, you see a psychiatrist who, is a specialist and is able to diagnose whatever it is your concerns are, and of course, take you on medication. If the issues are psychological, largely psychological, you're responding to grief, you just lost a job, you're having issues with a relationship, it may be worth to talk with psychologists. If you're not having unusual, behavioral experiences or sensory problems. Of course, the psychiatrist could also serve that function. But then a psychologist is also available to, take care of the individual. And then, of course, there are also the occupational therapists and the social support workers, social support workers as well. And what they look at, of course, is supporting individuals with, social skills, so the skills of, communication. You'd be surprised that do people really need to go to anyone to learn how to communicate? The truth is, yes, some people do. Communication, money management, learning assertiveness training skills, occupational therapists and social workers will be able to attend to those issues. And then, of course, there are private and public organizations that provide this care. Private, organizations, even though they seem not to be well known, because people don't even believe that, we actually have therapists in Nigeria. That's a comment that I get quite often. Yeah. There are a lot of centers springing up to provide mental health care for psychiatric disorders and rehabilitation, programs for substance use disorders. So all of those people are available. And then in the government hospitals, not all government hospitals provide psychiatric care, but there are certain dedicated psychiatric hospitals. So, for instance, in Lagos here, we have the Federal Neuropsychiatric Hospital, Yaba. Lagos here as well. All the primary health care centers in Lagos are enabled to be able to provide mental health care for people with, mental health problems. In Abuja, you have Aru, you have a psychiatric hospital in Calabar. Even, private hospitals that are not even designated for psychiatric care are beginning to become aware. And when they see presentations to them that are not very in the right direction.
Okay, good. Okay, you're back.
Yeah.
So we lost you there a bit. I wanted you to please just repeat what you said.
Oh, okay. So what I said was, in almost every state, you have specialist centers that are dedicated to providing mental health care to individuals who need the care. And, private hospitals and private doctors who work in those hospitals are also being trained and are, receiving continuous training on how to identify common mental health disorders so that they can help these clients and refer them to the appropriate centers. There's treatment, and I think I must mention at this point too that even religious organizations, because we wouldn't finish this conversation without talking about the involvement of religious organizations. They are also becoming, more aware of the causes of mental health problems. And even when people present to them and say, I come for deliverance, I don't know what's going on with me, after they've done their spiritual bit, I must commend them that some of them are also pointing these patients in the direction of help to receive care from seasoned professionals.
Yeah, that's great. That's great you mentioned it. Because I think it was 2 weeks ago we had the same conversation about mental health and religion, and how there needs to be a form of collaboration, because a lot of the times people find that the religious leaders like the first point of call when they have any of these experiences. So it's good to hear that a lot of them most of them are beginning to collaborate with mental health facilities and redirect people to where they can receive the appropriate care. I think that's quite exciting to hear that.
All right. But before we move on just a bit, yes, okay. I would like to talk a bit about COVID-19. I mean, in relations to this conversation that we're having now, I do understand, Doctor, that you're in Lagos and you're volunteering at the Lagos State COVID-19 Psychosocial Response Team. All right. Yes. And then there's some other persons who would tell you that because of the pandemic, a lot of people have been depressed. Some have been, very, very down. And this has led to, a few mental health disorder. Some others would tell you that for persons who have COVID-19, there's a widespread speculation that if you do not get the necessary support, psychologically, you could even give up even without the treatments normally from the medical doctors, and which is why we've had an increase in the number of deaths due to COVID-19 across the country, about 800 of them. Now, you work directly with some of these COVID-19 patients trying to, give them hope again. What exactly does it feel like trying to discuss with these persons who are battling COVID-19 at this time?
Well, so no doubt, there's been an increase in the, incidence rate of disorders associated with the COVID-19, and that's because the COVID-19 is a significant stressful life event. That it affects all of us, but, the thing about stress is we all react in different ways to stress. When the conversation on the COVID-19 started, people were, worried about COVID-19 pandemic itself, the fact that we didn't even, and still probably don't even understand what the virus is, the mutations, the number of deaths, the number of increase in cases. We're worried about the uncertainty. We're worried about, the lockdown, the restricted lifestyle. And of course, there were also people who had previously, who were previously diagnosed with either a mental or physical health disorder. And of course, when stressful life events happen, some people would wear and tear under stress, while some people will actually get better. But in working with these individuals, what the Lagos State Psychosocial Support Team has done is that they have, pretty much put measures in place so that there's no gap. And when I say there's no gap, I'm saying, so for instance, from the point of disclosing their results to them, which is pretty much making bad news, you have professionals tackling that. From that point to, them coming in as inpatients, they have people who are calling them regularly to support them, find out how they're doing, find out how their psychological and social health is as well. And then, of course, even when they do get discharged, we have professionals who are calling them to offer them support, to discuss with them about the stigma and discrimination they may face because of, the diagnosis that they had, previously had. So it's important to know that it's a continuum. So it's not just, you just call one person one time, because the truth is, we have people who had, COVID-19, who lost partners, who lost relatives, who lost children. And, for instance, I heard a story about, a young lady who lost her partner, and by the time the landlord at the house rejected her from the house, she had nowhere to go to. It was difficult. But of course, yes, because of the psychological and social support that the team has been able to provide, that has, given her a world of difference. So it's still work in progress, especially when, you still have people who doubt the fact that there is actually an illness like the COVID-19. So it's a lot of work, in progress, and it's a lot of work done by a lot of professionals at the same time to ensure that, we still up the gap and that there is no one left behind.
All right, yeah. Thank you very much for that, and thanks for all that you do over there in Lagos.
You're welcome. Thank you. All right. So, in the previous conversation that we had earlier, you talked about the different mental health professionals that we have in Nigeria, and the fact that more people don't even know that they're therapists. So I thought perhaps we could just briefly run through the list, or maybe like the different mental health professionals that we have in Nigeria, just for the sake of knowledge.
All right, well, so to increase knowledge this morning, it's important to know that when you hear the word mental health, a mental health team, a team, of course, is not made up of one individual or one professional. It's a lot of people who bring in their specialty to work together. Usually, I say to individuals, the first time you come into my office, you are likely to meet me with my team. So I head that team as a consultant psychiatrist. So the psychiatrist is a member of the team. A clinical psychologist is a member of the team. A social worker is a member of that team, a clinical social worker. And then you have a mental health nurse who is also a member of that team. You have an occupational therapist who is a member of that team. And then you have support workers. If you wanted to extend it, you'd also be talking about the fact that, you have psychiatric pharmacists, and you have psychiatric or mental health nurse practitioners. So, it's a lot of people who are working in hand to ensure that individuals with mental health challenges are assessed, diagnosed correctly, and of course offered the best care that is available to them.
Yeah, great. Doctor, I find that in most places that people go to, they don't always have this multidisciplinary team. Is it something that someone needs to request for when they go, or should they, should we be requesting for the team, or should we just work with whatever the center has, or whatever the place we go to has?
Okay. Well, so thank you for that question. And what I would say is our styles differ. So I have colleagues who would rather be the one to see, the individual by themselves first of all. So they identify the issues and they refer to the people that they think need help. However, the style that I have found to be more effective, even though, sometimes patients may see it as rather intrusive. And it's for that reason that when you are seeing a client, you ask them what their own preferences are. So they need to be seen by you as an individual alone, first of all, or they don't mind being seen as a team. Of course, you explain what the advantages are. It does not also preclude the fact that when you as an individual, so for instance, I see a client first time as a psychiatrist, and I find out that, this individual will need a psychologist or an occupational therapist, but it doesn't mean that I would wrap up the case and say, well, he's in there, you don't need to see anyone else. They also, in those other centers, so for instance, what happens in government hospitals is that to ensure effectiveness, one person will see at the outset. But when that individual finds out that this person is in need of other help, they would refer appropriate. So again, I think it's what works for the system, so that's another thing. What is effective for the system, what is effective for the individual, and what the individual then sees as, effective in the long term for the client.
Okay.
All right.
Yes, thank you.
We need to take a quick break now. When we come back, we'll take the calls because the calls are already coming in. If you'd like to tell us your name and location, it's not a problem. It's the first thing to do. If you want to stay anonymous, it's okay. We would ask that you go ahead and ask your question in a very civil manner. But I'll go over to the WhatsApp portal now to read some of the messages that we have here. We have a message from Neka. Neka says, thank you very much for this conversation this morning. I'm enjoying the program. But I have a question in regards to home care. Is there a way we can administer self-care for kids or teenagers when we notice a behavioral change? All right, so Neka is asking a message in regards to support from the home for kids and for teenagers as well.
Dr. Bray?
Okay. I didn't get the question, so I'm not sure if there's a mental health problem. I just had home care.
Yes, she's asking, is there a way she could give support for kids and then teenagers as well when you notice a change in their behavior?
Oh, well, yes, definitely. So, normal population, if you notice a change in a teenager or in a child, and you try speaking to them, you probably have gotten complaints from, so when you're dealing with a child, you need to deal with the child as an individual alone. You deal with the child as, you speak to the teachers, you speak to the friends, you speak to the siblings, and you speak to the parents as well. But of course, if you recognize that there's a change, you can take the child to see a professional. There are professional child psychiatrists and psychologists who use, means in such a way that they can, reach the child, either play therapy or other kinds of therapy to be able to, effectively reach the child and see what the child is going through. The child may just be responding to, changes in the home, such as maybe dysfunctional family, violence. They may even be responding to either bullying or changes in, problems with their schoolwork. So whatever you notice, is significant behavioral change in a child, please, by all means, let the child see a therapist. There's nothing wrong in seeing a therapist.
All right. Thank you very much for that one there. We have another message here, which is what's the difference between clinical depression and anxiety disorder?
All right. Well, thank you for that question. The first difference is that their names are different. And so that's to take it lightly. But more intensely is the fact that anxiety is being anxious. Anxiety is, everyone gets anxious every once in a while. However, an anxiety disorder is said to happen when the threat, the response to the threat in the individual is exaggerated. Or a disorder can be said to happen when the threat has been removed, but that person still continues to feel anxious. Or this individual just feels anxious for no reason. They can't put a finger to it. So for instance, somebody who has been, holed up in their house, has not been going out for the past 2 months, is telling you that they believe that they have COVID-19 just because they've been watching the news. Anxiety disorders, pretty much become disorders when they start to affect functioning in terms of personal functioning, occupational functioning, or functioning within, either the family or within friends. So the individual is unable to cater to things that they would normally have been able to. Depression, on the other hand, is a mood disorder in which, they are the core symptoms of low mood, energy, and lack of interest in formally pleasurable activities. Additional symptoms of depression can include, poor sleep, poor appetite, poor libido, feelings of hopelessness, feelings of worthlessness, guilt feelings, suicidal ideation, and sometimes suicidal ideas. So depression is a mood disorder, while anxiety, of course, is, relates to anxious state. They're two different things, but it's interesting to note that these two conditions can coexist with one another. Thank you.
Thank you very much, Dr. Abiri, for that. Well, we have this other very interesting question here. It says, please keep me anonymous. Is there anything anyone can drink to improve mental health?
Is there anything anyone can
drink?
All right, so I'll say
quite interesting.
Drink from the fountain of knowledge. And when I say from the fountain of knowledge, I say, knowledge about mental health, about yourself as an individual, about, being able to identify. If you know yourself, what has instructed us with ourselves? If you know yourself, I feel like that's pretty much more than half of everything. You know yourself, you know your triggers. You can ask yourself open, honest conversations. You know what your strengths, weaknesses, opportunities, and threats are. You know when you're not feeling on top of your game. It's important to be able to know yourself, know the things that keep you up. Knowledge, on the other hand, this knowledge for our own. We read about mental health issues, not because we want to have mental health issues, but because when they happen, we want to be able to identify and say, I've been sad. We all get sad every once in a while. But when it's persistent and it's interfering with our functioning, it becomes a bigger problem. So drink, I would say drink from the fountain of knowledge. If you know about it, if you know what it looks like, if you know what the symptoms and the signs are, and you're able to identify, of course, that knowledge would also include knowing where to get the best help whenever a problem arises. So there's no secret formula or secret question, if that's what you're asking. So what I would say is educate, empower yourself with information so that you can identify it when you see it.
All right, thank you. Again, we have a message here, this time from Sonny in Gwarimpa. Sonny's asking, if I'm depressed, how can I improve my mental health without medications? I guess listening to the program earlier, maybe he listened to the side effects and all that. So he's asking for ways to improve mental health without medications.
All right, so I like the question that he has asked, and he specifically, mentioned depression. It's important to know that, and I mentioned it earlier, not every mental health condition requires medication. For some, it can be, behavioral intervention. So there's in depression, especially mild depression, what you do for the individual is that you send them for psychotherapy. Psychotherapy is professional conversations with a skilled therapist. So that's something that we call behavioral activation in depression. And behavioral activation pretty much means well. So This individual feels that, when they wake up and they're feeling depressed, they don't feel like getting out of bed. They just want to be in bed all day. Behavioral activation says do the opposite of what your mind tells you to do. So your mind says stay in bed, get out of bed. If your mind says don't speak to anyone, you really want to talk to anyone, behavioral activation says get up, get on your phone, speak to someone, or visit someone. So medication is not the only, main thing for managing mental health conditions. This is important, yes, especially when indicated. But psychological and social interventions are also extremely as important. So what I'm saying is, starting out this question is, focus on what you can control. You can't control everything. Focus only on what you can control. Remove the distractions. Once in a while, exercise, take it from the physical and mental.
Fantastic.
Eat well, sleep well, exercise, practice relaxation techniques. Put on your mask first. Learn to take care of yourself. And remember to be kind to yourself. Remember that self-care is not selfish. And sometimes the only selfless thing you can do for yourself is to be selfish. So be care of yourself first. You cannot serve from an empty desk. Thank you.
All right, then. If there's any other thing you must take away from this program, I'm sure it's the last comments of Dr. Abiri. You must exercise, eat healthy, and get enough sleep. It's quite important for your mental health. Over to you, Chinyere.
All right, so just to wrap this up, I think Dr. Abiri has touched on it. We wanted to know, how often should people seek mental health support and mental health treatment?
And very often, and in an environment like ours, we almost always feel like until we see somebody who has stripped themselves naked and walking the streets, carrying lots of luggage, going into trash cans, that's probably they're the only ones that need mental health intervention. But the truth is, we all go through difficulties. And when we do become overwhelmed with the difficulties that we're going through, it's important to speak out. So, for instance, if you're having a difficulty in your relationship, or even in understanding the changes that your child is going through, and you are not a professional on those points, you can reach out to speak to someone. It may be the loss of a loved one, or the loss of a loved item, or, a job that you were hoping that you would get, and you were just laid off a job. So, significant life changes, such as, interpersonal changes, problems with relationships, or problems with interactions with other people. Even things like that. You can try to see a therapist. So, and then, of course, when there are major physical or mental health problems, so quite a number of people develop mental health issues because of underlying physical illnesses that they have. So, for instance, an individual who has suffered a stroke, or an individual who has had his limb amputated because he had diabetes, is likely to have a form of reactive depression. Even in those times, you can talk to someone. So people with joint and who have been having problems with having children for a long time, many of those situations come with a lot of mental health stress. And in those times, there's nothing wrong with seeking help. And of course, if there is a major mental health problem, please, by all means, seek and get help.
All right, then.
Thank you for that.
We must thank you very much, Dr. Gonjubola Abiri, for your wise words of knowledge and your professional sagacity. Thanks for coming on the program.
Thank you for having me.
Thank you very much. Chinyere Goldensi, clinical psychologist at Neem Foundation. I would like to get the phone number to reach for psychological support, as well as an email address, if you may oblige.
Yes. So for you to be able to contact us, the number for you to reach us on would be 0706 062 5054. I'll say that again. 0706 062 5054. And please remember that this contact number is only for psychological support and for mental health support. That's what we solely provide. And if you'd like to send us an email to sanctuary@neemfoundation.org.ng. Sanctuary is SANCTURY@NEEMFOUNDATION.org.ng.
All right. I intentionally saved a message for the last, and it's a message from Samuel Anyebie. He says, God bless you for this show today. It was all I needed this morning. So, ladies, thank you very much, and God bless you.